Thank you for joining us today. My name is Usman Shah, and I am a critical care medicine physician at Hoag Hospital. I specialize in treating patients with all sorts of life-threatening conditions, including what we will be discussing for the next half hour. Today, I will share with you the difference between sick and sepsis, when to seek medical attention. This presentation will bring you greater awareness of this lesser-known but very treatable syndrome known as sepsis, so that you or your loved ones know when to seek medical attention and survive sepsis. During this presentation, please feel free to put your questions in the chat box and I will answer them at the end. So I am the physician advisor for the sepsis program, but I partner with a team of highly skilled nurses and physicians in carrying out Hoag's mission to provide the best care to our patients, specifically those with sepsis. It is with the help of this team that our patients are rapidly screened for sepsis and treated with the most up-to-date medical treatments. By the end of this presentation, you will be able to understand the prevalence and impact of sepsis, what sepsis is and it isn't, identify risk factors in the development of sepsis, describe the stages of sepsis, understand specific treatments that we give for sepsis and why we give them, and also describe sepsis treatment and recovery. But most importantly, even though this seems a bit overwhelming, if there's one thing that I want you to take away today, it is how to differentiate when you are sick and when you have sepsis. What may start as a simple infection can lead to death, and you will be equipped with the tools now to recognize the warning signs and what actions to take in response. So, from Pope John Paul II to the greatest boxer ever, Muhammad Ali, to Superman Christopher Reeves himself, these well-known figures unfortunately died from sepsis. As you can see, it is not a disease of the old, not a disease of the frail. Not only does it affect the weak or the poor, it is an equal opportunity killer, hence why it's so important that we educate ourselves about it. It's not uncommon. In fact, every 20 seconds, someone in the United States is diagnosed with sepsis. That means at least 1.7 million Americans will develop sepsis every year. Every 2 minutes, someone in the United States dies from it. That's 270,000 Americans dying from sepsis every year. It's the leading cause of death in the hospital. Alarmingly, 1 out of every 3 patients that die in the hospital are dying from sepsis. Although it can affect everyone, elderly are more likely, 13 times in fact, more likely to be hospitalized with sepsis than those that are younger than 65. Most importantly, and why we're here today, is that as many as 80% of these deaths that are caused by sepsis are preventable. As you'll learn in this presentation, sepsis prevention comes through early recognition. So what exactly is sepsis? It's not the infection itself. It's our body's overwhelming toxic and life-threatening response to the infection. It happens when an infection you already have triggers a chain reaction through your body. This chain reaction causes the body to attack itself rather than just attacking the infection. And yes, it is true, your immune system can fight an infection too hard and risk damage to the body. This can lead to changes in blood flow, damaging and even destroying organs, preventing them from working normally. So now that we know what it is, let's put an end to some common myths you might have heard about sepsis. It's not blood poisoning. Yes, bacteria can get into the blood and cause sepsis, but sepsis itself is not blood poisoning. It's not the infection itself, but rather, the toxic response your body takes to fight the infection. It does not affect people that are only in the hospital. In fact, on the contrary, 95% of these cases happen in the community. So it is very important for our friends, our family, to recognize sepsis and call for help. It is not rare. As I mentioned, every 20 seconds, someone in the United States is diagnosed with sepsis. Many of those are unrecognized prior to arriving to the hospital. And most importantly, it's not contagious. You cannot pass sepsis to your loved ones. However, you can pass the infection that led to sepsis, such as a viral illness, it may have started as a cold, to a loved one if it's contagious. Are you perhaps unfamiliar with the word sepsis? If so, you're not alone. 35% of Americans have never heard the word. In fact, those that do know about it most likely have had a loved one that's been in the hospital suffering or fighting from sepsis. It's rarely heard on the local news or over dinner conversations. Why is that? Because A, it's not easily recognized, and B, it's hard to define if you haven't been diagnosed with an infection already. Healthcare providers tend not to use the word sepsis enough. You may know someone who has a bladder infection, for example, and then they develop confusion. Or they started with a bladder infection, ended up in the hospital, and now they need a ventilator to breathe. Although those are severe, these are likely signs that the patient developed sepsis from originally an infection. Also, death certificates usually state the original infection or illness as the cause of death, not necessarily stating sepsis as the cause. Sepsis can affect anyone, and in a bit I will share with you the risk factors for getting sepsis. But first, I'd like to introduce you to Mark, a healthy young man with no prior medical conditions who came to Hoag and developed septic shock. Mark had just returned from a trip to Hawaii in which he developed a blister on his foot that popped and became infected. What started out as a simple blister led to Mark fighting for his life. The following is his remarkable story. Please note, some of these images are graphic and may be disturbing to some of you.
My name is Mark Allen. I'm 32 years old. I came in contact with sepsis, and my battle with sepsis was in the summer of 2018. I felt almost that I had a flu or a cold because I had the chills, I had a little bit of a fever, I didn't have a cough, I didn't have a runny nose. And then it was that night when my temperature got up to 104.9 when I started to sense that something was not right. From that time, I was rushed over to Hoag Hospital in Newport Beach. I spent a couple hours in the ER, and while I was in the ER, they had already started treating me a little bit for sepsis before transferring me to the ICU. So when my parents arrived to Hoag in Newport Beach is when the decision was made to intubate me and put me into a coma. I was actually brought back on 4th of July. I remember being very weak. I couldn't do things on my own.
When you're watching your loved one in that situation, it's just the most helpless feeling in the world. Nothing you can do to change it. But when I got to watch Mark walk away from such a traumatic experience, it felt like I could breathe again. I mean, because the whole time you're in that hospital, you're holding your breath and you're just waiting for a miracle. It's so emotionally exhausting and physically obviously not as exhausting as it was for you, but it is exhausting to just be holding your breath and waiting for something good to happen.
There is no reason why I should be here today. All the medical professionals had doubts of me making it through. Don't be afraid to, go to your doctor over a fever, and don't be afraid to ask to get tested for sepsis, or at least start getting tested for sepsis, especially if you have a high fever.
Don't feel like you're a burden to call the ambulance or see your doctor or reach out to family if you have those symptoms. Don't let the conversation die. Talk about it, because it's a lot more common than I think anybody knows. I don't know why, but it's an incredibly serious topic, and it's something that he and I will talk about until forever. I mean, it changed our lives, and if our story can help anybody just to recognize those symptoms and to take them seriously, it will be a job well done.
I get to thank God every day that I'm still here, but I don't get to thank the staff that took care of me and brought me through this every day. Just like to say thank you to you all, from the hospital nurses to the doctors. to the rehab facility, as well as prayers from my friends and family, I pulled through, and it's because of everyone that I just mentioned, working together as a team.
Also, a huge thank you still to the Hoag staff. I mean, not a week goes by that we don't talk about you or think about you or are grateful for you and everything that you did to help us have the life that we have now. Because there was a time where I didn't think we'd ever get to have what we get to have now, and we do not take it for granted. So just thank you to the doctors and the nurses and everybody that was kind to us at Hoag. It made such a difference. We hope we don't have to come back, but if we did, you guys were just simply the best team, and we're incredibly grateful.
Mark and Brittany recognized there was something more serious than a typical infection and promptly sought medical attention. That was the key to Mark's survival. Thank you, Mark, for sharing your story.
My name is
Anyone
Mark
with an
Allen.
infection can develop sepsis. You don't have to be old. You don't have to be too sick to get sepsis. And Mark's journey demonstrates that. Even professional athletes, who are the epitome of health, have developed sepsis. For example, NFL quarterback Alex Smith developed septic shock from a skin infection that he developed after a devastating in-game leg injury. Sepsis doesn't discriminate. However, you're more likely to get sepsis if you're very old, older than 65, or very young, if you have chronic illnesses like COPD, diabetes, kidney disease, if your immune system's weak, if you've had chemotherapy for cancer, if you have a transplant and you're on transplant medications. Diabetes actually suppresses your immune systems, hence why it's so important to control your blood sugars. Anyone who's had recent surgery, anyone who has an implanted device, like a pacemaker, a catheter, an IV, that they're getting medications through, any of those patients are at slightly higher risk to develop sepsis. How do you develop it? It always starts with an infection. Always, always, always. Any type of infection can lead to sepsis, but the infection may not always get identified before it's too late. Infections can lead to sepsis most often in the lung, the urinary tract, the gastrointestinal tract, even the skin. Even kidney stones can lead to sepsis. I would be remiss to not mention SARS-CoV-2 or COVID-19 as the most prevalent viral illness that has led to sepsis in the last year. In fact, a large percentage of the people that have died from COVID-19 actually died from the sepsis that COVID-19 caused. All right, now I'll take you through the different stages of sepsis. It is a progressive disease, and because it is an uncontrolled response by the body to the infection that one develops, it won't be stopped unless medical treatment is provided. That's important to know. So if you feel like you may have any of these signs or symptoms, think about sepsis. First stage of the sepsis is actually just infection. Infection can be bacterial, it can be viral, fungal, even parasites. So this is where you have to just be aware of an infection in your body, get it treated, or keep it clean if it's a wound, and hope that it does not progress. Cellulitis, a simple cut or a popped blister can lead to a major skin infection, also known as cellulitis. Pneumonia, a bacterial or viral pneumonia, may start with a mild cough or a fever. Kidney stones can even cause obstruction and be the nidus of a urinary tract infection. So that was stage 1, and that was the infection itself. Stage 2 is a normal response to the infection that our body has. It's an inflammatory reaction that occurs to the infection, known as systemic inflammatory response syndrome, or SIRS. Here you might have a heart rate that's a little faster than usual. You have a temperature that's a little high. You may have a slight fever. That's okay. We're not in a danger zone yet, but as long as you're aware what your body's doing, all of this is so far so good. All right, now we're in the third stage of sepsis now, where for unknown reasons, the body's normal fighting response goes haywire. and the body starts attacking itself. Here, imagine that the body is shooting bullets at the infection, but there's an incredible amount of collateral damage. This haywire response can cause swelling in the organs, swelling in the tissues, as well as leakage of fluids into the areas where fluids shouldn't leak, such as your lungs. Signs and symptoms of this could include very high fevers or persistent fevers, very fast heart rate, breathing really fast, or in fact, just feeling really short of breath. You may feel really tired. Generalized fatigue is very common. In fact, also, you may feel pain out of proportion with the degree of injury you may have had. If it's unusually bad pain, or you're extremely tired, or you're feeling like you're short of breath, seek medical attention. Nausea, in fact, might also start to kick in. What was a normal response in stage 2 just took a turn for the worst in stage 3. Now we're in deep trouble in stage 4. The overactive fighting response is now causing blood vessels to dilate. Organs are starting to shut down or get damaged one by one. Our normal acid-base balance in our body starts to get acidic. That fever may be extremely high now, and confusion may set in. As you saw earlier, Brittany mentioned that Mark started to get loopy the day before he came to the ER. He was getting very tired, and she knew at that point something was seriously wrong. Breathing may get very difficult. Dizziness or feeling like you're about to faint may be present. The skin may start getting pale or discolored or cold in your hands and feet. At stage 4, the kidneys are possibly starting to shut down, leading to no urine production. Patients experiencing this stage of sepsis commonly describe a feeling of impending doom, or I feel like I might be dying. Stage 5. This is the most dangerous final stage of sepsis, ending in septic shock. Now this is life-threatening. It is the most critical phase and needs to be managed in the intensive care unit. Signs of septic shock include low blood pressure, and breathing is so labored that you may require a ventilator to breathe. Just like it did in Mark's situation, actually. Some patients may actually require dialysis because their kidneys shut down. Or if they had a skin infection that got so bad, they may require surgery, in extreme cases, amputation of the damaged tissue. Here's what's very important. Just like a stroke or a heart attack, septic shock needs immediate medical attention. If you or your loved one is exhibiting any of these signs or symptoms, dial 911. Time is tissue. The moment you get to the hospital, from the moment stage 3 begins to the moment you get to the hospital, every single minute counts. Most patients with sepsis are able to avoid ICU admissions, but even with this avoidance, the mortality rate is very high. Here at Hoag, we have been committed to sepsis recognition and treatment for over a decade. We have the tools and expertise to treat your loved one, so the most important thing you can do is recognize what is happening and bring it to medical attention immediately. Treatment focuses on swift action. You or your loved one will receive immediate attention to your sepsis diagnosis, including rapid administration of antibiotics when indicated, intravenous fluids, and aggressive blood pressure support. Our team is here 24 hours a day with doctors and dedicated sepsis nurses to make every step of treatment efficient and appropriate. Through early recognition and treatment, more people are surviving sepsis than ever before, and we're seeing this a lot at Hoag. But survivorship comes with new problems and consequences that may continue for years. The fight is not over when the patient goes home. Up to 50% of sepsis survivors experience post-sepsis syndrome. The Sepsis Alliance, which is a national nonprofit bringing awareness to sepsis, has been studying the syndrome and summarizes it nicely here. Common problems that you may develop with post-sepsis syndrome include you can't concentrate, your memory's not as good as it used to be, you're feeling anxious, you're feeling depressed, you may be weak, and things that you were able to do normally before you got sick, like dressing yourself, like bathing, may become really difficult now. You may end up having another infection. Actually, A lot of patients that have sepsis and survive it end up back in the hospital at some point. Setbacks in the ability to control chronic heart, lung, and kidney diseases could be a problem. So hence why it's so important to stay in touch with your primary care physician at that point to make sure that they're following up on these conditions and making sure that they're not deteriorating further. They could also include severe psychological or emotional effects such as panic attacks, nightmares, PTSD, decreased mental functioning. As a result, many patients have difficulty returning to work, have trouble with their relationships, or returning to school, or doing their usual hobbies like they used to before they got sick. If you are a sepsis survivor and are experiencing forgetfulness, poor concentration, weakness, anxiety, or depression, think about post-sepsis syndrome and reach out to your physician. Spouses or family members are often affected too. Many serve as caregivers, helping with feeding and bathing and attending doctor visits, organizing your meds and pills that you're taking. This is a stressful time, and many family members report feeling overwhelmed and depressed. Unfortunately, setbacks in the weeks after sepsis are common. Almost 25% of sepsis survivors that were hospitalized may end up back in the hospital within 30 days. For some patients, the cause of their post-sepsis syndrome is obvious: blood clots and poor circulation caused by the damage the body did to itself, where they were ill and have caused gangrene, resulting in amputation of the fingers, toes, or limbs may occur. Damage to the lungs can affect the breathing. Researchers have found that sepsis survivors may be more vulnerable to getting viral infections in the lungs. Other organs may be damaged as well, such as kidneys or liver. These lasting physical issues can be explained, but there is more to post-sepsis syndrome that cannot be explained, such as the disabling fatigue, the chronic pain that many survivors experience. Others complain of unrelated problems, such as hair loss that may occur after they got discharged from the hospital. It's a fairly well-researched, and we are investigating more about what post-sepsis syndrome is. So reach out to us, and we will help address a lot of these problems if you're suffering from them. Can you do something to reduce your chances to getting sepsis in the first place? Absolutely. First and foremost, talk to your doctor. Don't be afraid to say, I'm worried about sepsis. Taking good care of those chronic medical conditions is very important. Also, get your age-appropriate recommended vaccines, such as the flu and pneumonia vaccines when you need them. Keep your scrapes and wounds clean. This is very important, even for the healthiest among us, especially with more and more antibiotic-resistant bugs that are circulating in our community. It's very important that you keep those wounds clean as possible. Remember the signs and symptoms of sepsis. A combination of one or more may be enough to trigger seeking medical attention. And finally, act fast. Get medical care immediately, either in person or through telehealth. Ask your doctor, could this be infection that's leading to sepsis? Should I go to the emergency room for a medical assessment? A lot of times you may wonder, well, am I just sick? Or is this something more serious? And hopefully this table helps you out a little bit to try to understand that. A low-grade fever, that's okay. That's common after an infection. That's a normal body's response. But a very high fever, feeling chills, or feeling very cold, that's not okay. Talk to your doctor or reach out at that point. In the setting of being sick, if you're confused or loopy or very tired, that's not okay. Seek medical attention immediately. If you're having abnormal breathing, if you're breathing too fast, breathing too slow, or just feel short of breath, you should be concerned at that point. Call 911. Make sure that you address that problem, because it's not common to have that after, say, a urinary tract infection. Severe pain out of proportion with injury is not okay. Most importantly, if your blood pressure is low, or you feel like you're about to faint, or you're near fainting, that's never okay. Call 911 immediately. So the Sepsis Alliance has developed a helpful way to remember the signs of sepsis. Think time. T for temperature. Is it high or lower than normal? I for infection. Do you have a cough, a recent scrape or wound, a urinary tract infection or other infection? M for mental decline. Are you confused? Are you sleepy? Is a family member having a difficult time waking you up? E for extremely ill. Are you having severe pain? Is this pain out of proportion with the cut or scrape that you did have? Are you having pain in your flank from maybe a UTI that you shouldn't have? Are you feeling really short of breath? These are the extremely ill signs that you should keep an eye out for. Any combination of these could mean you have sepsis. Seek medical attention. Call 911 or have someone take you to the hospital immediately. If you call 911, make sure you tell the operator, I think I may have sepsis. When the paramedics arrive, tell them, I think I may have sepsis. Very important you do that so that you can lead them to the likely diagnosis that will rapidly get you the treatment that you need. Sepsis is a medical emergency. If you have severe sepsis, your chances of survival drop 8% every hour that you go without treatment. I'm going to repeat that. If you have severe sepsis, your chances of survival drop 8% every hour you go without treatment. Hence why it's so important that you recognize it. The first few hours are critical. The first 24 hours can be decisive. Thank you, Mark. Thank you, Brittany, for sharing your story with the world. Jody Lennox for helping bring sepsis awareness to the forefront today. Yahya Dawood for providing the AV video of Mark. Josephine Robich, Hoag's Community Outreach Manager, along with Chris and John, for providing us with this platform to bring sepsis awareness to our community. I'd like to now open it up for questions. This presentation will remain on Hoag Health YouTube channel if you have friends and family that are interested. Thank you for your time today. All right, so I think we have a question. Our first question of the day is, how common is it for replacement joint infections to cause sepsis and become fatal? So the incidence of joint infection itself is about 1 in 100, maybe. 1 in 100, according to the American Academy of Orthopedics. Now, any of those infections, when not taken care of, can lead to sepsis. And once they get to sepsis and they start going through those stages, they can lead to stage 4, stage 5, and be fatal. So important recognition after joint surgery, talking to your orthopedic surgeon, making sure that you don't have a fever, making sure that the incision sites are clean, you're not having pain out of proportion with the surgery is very important. All right, is there another question? Okay, we'll hold. Is someone with autoimmune disease more susceptible to sepsis? Absolutely. So a lot of our patients that have autoimmune diseases tend to be on immunosuppressive agents, such as prednisone, Cellcept, Imuran, whatever it may be. Those autoimmune suppressing drugs are great for suppressing your lupus flare or whatever autoimmune illness you may have, but they also suppress your response to infection. When they suppress that infection response, then you progress through those stages of sepsis more rapidly than you may if you weren't on those immunosuppressive agents. I hope that answers your question. A lot of this information is available on the Sepsis Alliance page. If you have any other further questions, you can reach out to us on this platform and we will answer those questions within 24 hours. Thank you very much for your time today. Thank you everybody that was involved in allowing us to speak about sepsis, which is near and dear to us to take care of our community. Please take care of yourselves. We love you all, and please reach out to us if you have any questions. Thank you.